The ACEs Optimist Show with your host, Dr. Craig Morris.
Hi, everybody. Dr. Craig Morris here with ACEs Optimists, which is dedicated to optimizing human potential in the clinic of life. What does that mean? Well, we all have potential. We all have gifts. Question is, which ones do we have and which ones can we maximize with our opportunities in life to get the most out of it? Today's guest is Dr. Matthew Kowalski. He is a longtime colleague and friend, brilliant clinician, working with Harvard University as a chiropractor, as an instructor. Matt, welcome.
Hey, welcome. Thanks so much for having me on here today. It's been a long time getting to see you.
It has. We were just talking about it. It looks like maybe 20 years since we've really had any real time to have any discussion or time together, which is way, way, way too long.
Sure is. We had some intensive time back in the mid 90s, which was great. When you were editing and putting together your book, that was great.
Absolutely. So Matt was a key contributor, along with his friend and mentor, Dennis Kogsberg, Dr. Dennis Kogsberg, for two of the chapters in my low back syndromes textbook, which was published in 2006 with McGraw-Hill. And they had both they did the disc chapter, and they also did the
stenosis, lumbar stenosis.
Yeah, the lumbar stenosis chapter. And these were two of the strongest chapters in my book. And I want to get into that because what resulted in that for you guys after that was published was really fascinating. But what I would really like to start with, because as I said earlier, we're trying to understand more about human potential and excellence. And so you are a perfect example for young doctors, young clinicians to get an idea of, okay, I have my interests, I have my capacities, but how do I maximize them? How do I utilize them? How would I, for example, have the opportunity to move all the way up into a position where I could see patients, where I could teach at Harvard University, leading top-rated university in the United States, which you have done, and I know very well that you earned your way there. What are the characteristics that lead to these? So I'd like to understand and start off by just understanding a little bit about your youth and the things that drove you towards chiropractic, and maybe things that inspire you to to move in the direction you moved.
Oh, sure. It's kind of funny. You talk about youth. I grew up in a family that my parents decided that one of their sons would be a doctor, and one would be a priest, and one would be in finance, and so they had our careers mapped out for us, and I don't think any of us went the exact pathway they had hoped for. I obviously am not the priest, and nor either any of my brothers either, but it's kind of funny. They always had this interest in me being the doctor, and fortunately it kind of synced up with my interests as well. I always had a great interest in biology. I remember going to the library with my mother, and just going into the aisles in the library and pulling out the biology books and sitting on the ground and reading. And we would go to bookstores and do the same thing. So I was always kind of attracted to that direction, and I just loved the little scientific inquiry, playing with their own experiments and things growing up as a kid. So that was in there, and quite honestly, my intent was to become a medical doctor. And in fact, I will tell you that chiropractic was really a last-minute decision on my part.
Mine too, by the way.
Was it? Yeah.
Yeah.
Yeah. It was kind of funny. I got some upset parents from my decision to be a chiropractor, to be quite honest. I didn't really know much about chiropractic. I used to walk past a chiropractor's office growing up all the time, go to a skating rink that I would go to, and I'd look over and wonder what the heck does that word even mean? And my dad told me about how he went to a chiropractor when he said I was carried into the office, couldn't walk, and literally walked out. And I thought that was the most fascinating thing that he had done. He said a blind chiropractor. He remembers lying on the treatment table and hearing the cane tapping into the room as the chiropractor came in, palpated his back, and he said I thought he killed me. He says, and I get up and I walked out. He said I felt fantastic. So that kind of planted a seed for me of interest. And so that was sitting in the background. And it's funny, we were growing up, Sunday nights were watch 60 Minutes, have a breakfast for dinner, and sit around and talk. Well, 160 Minutes was on, and it was on chiropractic, and it wasn't an expose.
I remember that.
Yeah, it was actually Dr. Jancy was being interviewed, and I watched that and thought, wow, what a fascinating idea to actually help the body do what it's supposed to do and heal, help it heal itself. So that was in the back of my head for years as I was kind of planning my career pathway to medical school. Those are the early days of interest in this profession.
Interesting. I had kind of a similar background. I went with my father to a chiropractor when I was very, very young. I barely remembered it. But it was there somewhere in the back of my mind. And then I graduated high school, was pre-med, I was going to the university, and I came across a guy who I worked with in the summertime who was finishing up his chiropractic training, and we would talk about it, taking breaks and chat about it. And he brought me some documentation. I started reading about it. I became absolutely fascinated by it. And then more, I became interested and wanted more understanding. And then by the time I was at the university, I said, you know what, I'm interested. I want to go into chiropractic. So I had still never been to a chiropractor at that time, but I liked the idea of the natural care, the non-medical care, non-surgical care, the idea of being a primary access clinician and a doctor, and that it was involved, with sports and natural healing and hands-on work. And because I always liked working with my hands, and so I thought I would probably become a surgeon. Yep. But at that point, I made my change, and by the time I, finished up my university, I was set up for chiropractic school.
I loved the idea of orthopedic or neurosurgery. Those are the two areas that I was considering. I love the whole profession of orthopedics and it's funny. I grew up with a dad who was a carpenter, and I looked at orthopedics as a lot of applied carpentry.
My father was a carpenter.
Is that right?
Yeah. That's right.
Yeah.
Yes.
Oh, that's great. I went along with that. I had that seed planted in my head back at 14 years old, and here I am going. I went through high school and get into college, and wanted to kind of help pave that pathway to med school. So I took a job in a morgue, and I did for 3 years. I did autopsies. I did the body eviscerations, and I saw pathology that I never saw after that. It was amazing. I mean, the every day you would see different pathologies, and I went from there to work in a neuropathology clinic as well, and then ultimately my junior year in college, went to work in a local operating room. I was a nursing assistant in an operating room. And so I had seen, a lot in the morgue, started to see a lot in the operating room. And then one day I'm wheeling a guy down for surgery, and he says to me, "Hey, what are you doing after undergrad?" I said, I'm going to med school." He said, "Have you ever thought about chiropractic?" I said, "Geez, I actually have." I said, "Why do you ask?" He said, "Oh, my son's a chiropractor. You should meet him." So okay, writes down his son's address and phone number and his name for me, and says, "Give him a call. I'll let him know you're going to call." And that was my turning point. Is working in medicine to go and find chiropractic. And the funny thing is, after I met with him and decided to become a chiropractor, I was in the break room one day, and chief of anesthesiology came in and was talking to me, and he said, "So what do you do? What med school are you going to go to?" I said, "Well, I'm thinking about being a chiropractor." He said, "Why don't you become a physical therapist and make an honest profession, profession?" Um, and he got me so enraged. But the funny part is, when I got out of school, he and I had a great referral relationship after. So it was my first experience with anti-chiropractic bias was right then. So
Yes, I dealt a lot with that when I first started in practice. Only one orthopedist in the whole region, and then in the South Bay of Los Angeles, would accept a referral from a chiropractor. Only one.
oh yeah,
And I had lots of nasty statements from physicians in the area when my patients would go to see them and mention that they were seeing me. Many patients taken away in the early days, and then. But you and I think we're the same. We were both looking to work with other healthcare providers for the benefit of our patients. We knew we didn't know everything, and we kept searching for those. And for me, if I did find orthopedists then or surgeons, I would say, if you're going to have surgery on my patient, I'm sending you. I want to be in there. I want to learn. I want to understand what else needs to be done. And that's how I made my relationships. And after years, majority of my referrals were from local physicians. So it transitioned. And I think our generation was very good at helping to break down those barriers and open because we went and we realized that these specialists, these physicians were not going to refer to us just because we had a DC license. They needed to have something special, find something special where they could trust and establish a relationship. And then by doing that, then they'd feel comfortable referring their patients.
oh yeah,
And for me, I would always look to say, well, in the end, what I'm looking to do is to look for your problem cases that are a hassle for you that I think I can help you with. And look for so find their problems.
yeah, absolutely.
Their problems, instead of thinking with hat in hand, can you please send me patients?
Yeah, just send me the tough ones. Just send me the tough ones that nobody else can get better.
Yeah,
those are the ones I think. Those are the ones I think you really can make your bones on. Absolutely. Oh, what year did you graduate?
I graduated in December of '81 at Cleveland, Los Angeles.
So you're 81. So you're before the cultural change. And you think about it. I was
Yes.
Here I was in 1990. I went into chiropractic in 1986. Look what happened in 1987 with the Wilk trial.
That's right.
I mean, you had more obstacles.
Oh, big time.
And I had this serendipitous event of the Wilk trial being settled in 1987 that completely changed the trajectory or opened the opportunity to change the trajectory of this profession.
And I think I should help the audience a little bit, especially for our younger viewers. The Wilk trial was the successful culmination of our antitrust lawsuit of the chiropractic profession against the AMA, American Hospital Association, a number of defendants, because they were found guilty of trying to eliminate the chiropractic profession in the 60s, 70s, which left then a negative impact on the profession, publicly and certainly professionally, all through medicine. And so that finally came out. We finally won that lawsuit, and it really changed the way that medicine looked at us, because before the 60s, there were increasing number of established relationships and work relationships with chiropractors and physicians. And then that came to a screeching halt for decades. And then that opened it up. So I got to tell you, Matt, your time was good.
Oh yeah, I mean, and absolutely. But you and I, in our early professions, throughout the first decade of yours, were trying to work with doctors who were taught, if you receive or make a referral to a chiropractor, you are in jeopardy of losing your license. And so it was driven in that deep. I mean, there was a multimedia campaign to control and eliminate the chiropractic profession to defame us.
Right.
And there is still waves of reverberations of that happening today. That from the contain and eliminate, or the Committee on Quackery and the AMA, and what they were trying to do to the chiropractic profession, as well as other professions as well. So they kind of eliminate the competition, basically.
Yes, it wasn't just the chiropractic profession. That's exactly right.
Yep. So
That's
an interesting time to get in,
That's good timing. So then you went off to National Chiropractic College to study chiropractic under the late great Joe Jancy, Dr. Joe Jancy. You mentioned him earlier, and again, a number of the younger folks, especially, and those that are not chiropractors that are listening in with our multidisciplinary audience. Dr. Jancy was one of the great minds in the profession, one of the great academicians in the profession, and was absolutely a leader in moving us forward in the quality of our education, in the early research to support our approach to care. He was a model, if one were to look into his life and his life history, of humility, of dedication, of professionalism, of straightforward, no nonsense, that I guess that greatest generation is known for. He exemplified so many of those attributes. And so you were very fortunate in your timing to have some time with Dr. Jancy.
Well, actually, you know what? Would you believe I got in there right when he left? I had only a couple of months of crossover, and I didn't get to work with him. Dr. Winterstein had come in at that time.
Wow.
And again, great radiologist and great clinician, who became our leadership at National. So there was just that, I was just in that transition time. And although we had a great leader, I lost the opportunity to work with a great leader as well. But so that was in 1986. I moved out into Chicago. In fact, I'll tell you what, I went to the first 2 semesters of chiropractic. I flew home and said to my parents, I'm not sure if I want to do this. I said, here I am learning about all the things that I can't treat. And so I got a little frustrated, and I went to at the time, one of the deans of admission to BU Medical School, who was a friend of my parents, and who I was going to go to BU Medical School. That was my direction. And I met with him, went to his house and sat down, and I remember him saying to me, okay, you want to go to med school? He goes, that's fine. He says, we can go in that direction. He says, but I want to ask you, why would you ever leave that profession? He said, if I did it again, I'd be a chiropractor. And I couldn't believe it. He said to me, and I'll never admit it to his colleagues. He said, but I love what chiropractors do. And at that point, I turned right around, and that was it. Became embedded into the profession and dedicated to it. And kind of funny, years later, when I graduated, I lived about 4 houses down from him, and I used to see him and walk in the mornings before he passed away. So it was neat, but it was one of another one of the turning points in there.
That's fascinating. And then you had a stellar academic career at National. I know you were a star there, and then you continued on and did a 2-year postdoctoral fellowship there in orthopedics.
And talk about timing again, right? So here we are finishing up. I am going into 9th trimester, and during lunch breaks at clinic, this speaker would come in, a clinician would come in and present cases. And he would go over radiology, go over cases, and kind of really, really bend our minds and make us think and apply what we had learned. And all I could think of is, wow, I want to learn from this guy. His name is Dennis Skogsberg. And so here we are a few months into it, and find out that he's going to create an orthopedics residency program at National. And so, again, my intent was to go home, hang up my shingle, and start practice. But after meeting with him, I had finished all of my numbers and everything in school. I was allowed to go and shadow him because he was doing orthopedic, he was doing specialty consultations in orthopedics and radiology. So I went and shadowed him for a couple of months and said, I've got to do this. I've got to do this residency program. So I applied for that and became his first resident in orthopedics at National. There was a residency program years before. It had faded out, and then Dr. Skogsberg came in, and I spent the next 2 years under his mentorship, which was just phenomenal. We used to call it, the sipping from a fire hydrant. We learn a lot from him. Literally could spend 8 or 10 hours in a day just sitting down at the view box and going over case after case. And we would go over to Loyola. I remember we'd go over to Loyola University Medical School's their library, and we'd pick a subject, and we would go and literally spend 4 or 5 hours photocopying a stack of literature, and that's what you got to read for the next month until we did our next trip back there. So we used to make our monthly trips in. We digest material, put it into slide programs, and teach, and bring case material into it. And that became the foundation for teaching on the road and teaching at school.
Right. And then you finally got into practice. And I remember I came to visit you once, I remember, in the Boston area, in Massachusetts, but I can't remember exactly what city you were in. Now I've forgotten. I used to know. And you were growing. And then I asked you, because I knew how brilliant you and also Dennis, who was both teaching, who was overseeing the residency for orthopedics and radiology, which was unheard of. I don't know. I've never heard of anybody else taking on those two areas of specialty with such brilliance and overseeing both. But that was Dennis Skogsberg. And then he went to go work at the largest private spine facility in the United States with the Texas Back Institute for a number of years. And so because of our relationship, our friendship, our collegiality, I invited you guys to take on the critical disc chapter and the spinal stenosis chapters in my textbook, my low back textbook. And I didn't have any idea what I was going to get back. I mean, I just thought they would be great, but they were way better than that. They're still actually the best disc and stenosis chapters I've ever read.
Oh, wow. Thanks. Well, we had a lot of fun doing that too. I tell you, Dennis and I were incredibly close before that. But, collecting the information and collaborating on that, and, he and I would meet to teach classes, and then I would get on Texas Back Institute and to his home, and we'd spend a couple of days working on the chapter, and we were back and forth for quite some time working together on that. And it was exciting. I mean, in that process, I learned more about stenosis and the disc than I had ever previously known. So it was a great learning experience, as well as working with a cherished mentor, as well as coming up with something that that you put together to benefit this profession and all professions, really. I mean, I think it was that text is a great tool for everyone, for physical therapy, orthopedics, everyone. So
right. I mean, I really wanted to specifically, well, not specifically, but primarily for chiropractors and physical therapists, because physical therapists were in the process of taking on the doctoral role and primary access role and growing as a profession. And so I wanted to be available and readable, and at the same time help us to integrate into a bigger field as a chiropractic profession, to integrate into the bigger role, taking its proper role and proper seat at the table among healthcare professionals in the United States and globally. That was my goal. And I was fortunate enough to get a lot of the leading physicians in the spine world in their specialties to write for me, and to accept me as their editor. And I thought that was helping to set an example for the future.
So would you ever be crazy enough to do it again?
It was interesting. I initially started it with a colleague. We were supposed to team up, and then he backed out.
Yeah.
I'd already signed the contract, and I gave myself a couple of weeks to think about if I was going to still do this. But I just had the book in me, and I had to get it out. And if I did it again, I mean, they say writing a book is the loneliest loneliest thing you can do in life, and I'm sure that's true by my experience. So it took me 5.5 years, and I'd have to do some things differently. I can't say no, but I'd have to have things done differently the second time around. And probably some of those came up, then I would definitely be involved, help to lead the way or co-lead the way. So I'd be interested.
Right.
So then I think what was interesting to me also, after you guys did your chapter, you went on the road with your material, and you were teaching about disc stenosis all over, even I think including Harvard, right?
Well, we were, back in the residency program, Dennis got me involved in teaching, and I have a funny story about that. But I was teaching more orthopedic evaluation. I was teaching, basically some of the earlier coursework for the diplomate program in orthopedics. And then once we worked on the chapter, then I put together a program series on advances in spine care. And so the first program in advances with spine care was on the disc stenosis and sacroiliac joint disorders. So we had a 3-part series with that. We did a similar type of thing in the cervical spine as well. So we were able to through the National University, their postgraduate program, they got behind us, and we were able to deliver that around the country in the orthopedics program. But we also did it privately. I did it in the hospital that I was in, the first hospital that I was in. So the first hospital I worked in was Braintree Rehabilitation Hospital in the town of Braintree. And so I used to host different orthopedic and postgraduate programs in there for our CMEs, but it was for any profession as well. So it was a great bridge into that. And really, when it came down to it, lumbar spine was really one of the key things everybody wanted to learn about. I think they still need to learn about it.
Yes, I'm sure you're right.
Yep.
So then that also helped you. Didn't that also give you a little extra support in your move as you started to get opportunities to work more closely with Harvard? The book, yeah, and your work there and your contacts as you were growing.
Yeah. So all of these things lay a foundation, right? I mean, you'd be surprised what early career things can do for later in your career. When you later go for an academic appointment, it's kind of nice to have authoring chapters in a couple of different books,
right,
as part of your foundation, because those are some of the parameters that are looked at. So, all of your contributions to education, to science, to clinical work are all taken into consideration when you're applying for and hoping to get an academic appointment. Which I think mine is it's been several years now, but it was decades in the works to get there.
So tell us a little bit about some of the key the key points that occurred in this evolution towards becoming an instructor at Harvard and be more full-time. You're working full-time now at Harvard, are you? Is that right?
So I actually work for Brigham and Women's Hospital, which is one of the affiliate hospitals of Harvard Medical School. There is a firewall between the two, but I can tell you that it basically all started I go back to 1993. I was at the time invited to do some lectures at Northeastern University in their physical therapy program, in their master's in PT program. So I went and did some guest lecturing and talked about orthopedic evaluation at the Northeastern's program. And during that time, got to meet a number of PTs. But at the same time, here we are in 1993. Well, what happens in 1994? David Eisenberg at Harvard University or Harvard Medical School publishes in the Annals of Internal Medicine one of the more important articles on complementary and integrative care in the United States. And it exposed the fact that there was more money being spent out of pocket for non-medical procedures or treatment than was actually being spent out of pocket for medical procedures. And it raised the eyebrows of medicine to say, okay, what's going on here? And so David Eisenberg took an interest, of course, had a strong interest in integrative. At the time, we call it complementary medicine. And at the same time, here I am trying to get inroads into the medical profession. So with David's article out there, it kind of greased the wheels of healthcare a little bit. And so this local hospital, rehab hospital, Braintree Hospital, was considering adding an acupuncturist. So one of the PTs that I worked with at Northeast University said, hey, this is what's going on over at Braintree Hospital. You should meet with them. So I went over and met with this guy, I think his name was Larry Tennant. And Larry was going to open up this little integrative or complementary care clinic. Well, it was open and closed in 6 months. It just didn't, the operations weren't there. However, I would say that the glass ceiling was a little bit broken. It was at least cracked. So I walked down to the medical director's office and asked for an application for privileges for the hospital. And they said, what do you do? I said, I'm a chiropractor. And they gave me the application, and it's a paper application at the time, so I complete this over the weekend, bring it back. And I remember the secretary looking at me saying, you have it done already? I said, oh yeah. I said, she says, just a minute. So she goes and gets the medical director and hands him the application. And he says, come on in, let's talk. And he says, Jim Liliestrand is his name. And Dr. Liliestrand sits down with me and says, what do you want to do? I said, I want to treat patients here. He said, why? I said, well, this is where the patients are. You guys are a great rehab hospital. He said, well, what department would you want to be in? I said, well, put me in rehab medicine because I know that they really don't care for chiropractors. So let's see if we can make it work there. He looks and says, let's do this. And so they granted me consulting privileges, and he and I, for years after that, contacted or worked with many medical directors in different hospitals to help bring chiropractors in. But the funny thing is, we had to change the bylaws of the hospital. The bylaws actually said that they couldn't make nor receive a referral from a chiropractor. And that one of their policies and procedures in rehab was that if a patient was under rehab care and they were found to be receiving chiropractic treatment, they were advised that they had to discharge the patient or the patient had to discontinue chiropractic. So that's where we came from in 1994. And so I had a practice literally 3 miles up the street from the hospital that I had opened 2 years before. And I got a treatment table in a private area in rehab, and I started bringing my patients in and treating them, and the PTs were seeing the patients come in and out. And I would go into their break room to read my x-rays. At the time, we had x-rays. We had sheets of x-ray
Films, yeah.
Yeah, and so then I started to teach them diagnostic imaging. So I started holding pro classes in their break rooms. I did a lunch and learn program for the PTs, and so we review X-rays and things, and so I started to pull that department together with chiropractic. We actually had one PT leave because they didn't want to be working with a chiropractor. They left and took another job. But over the years, here it is. I should say at the same time now that David Eisenberg had published his paper, and then I did that for years. And then one day I got a call in my office. My office manager says, "Hey, there's a Dr. Eisenberg that wants to talk to you." I thought it was a joke. I thought it was Lou Sportelli calling me and joking around. So I took the phone up and he says, "I'd like to invite you to do the impossible." I said, "What's that?" He says, "I want to create an integrative care center in an academic medical center." He said, "I want you to be part of our team." And the reason why the reason that David got my name is from Dr. Adams out of LACC.
Alan Adams.
And Lou Sportelli, Dr. Sportelli.
The great Lou Sportelli.
Yep. The two of them had said, Dad told David he should contact me. And so that was kind of the beginning of it all for me, was to meet with David and come together with this team that was created back in 2000.
Well, I remember flying back there to a meeting that was hosted by Dr. Eisenberg and actually presenting him with a copy of our textbook.
Yeah.
Out of appreciation for everything that he was doing with his integrated program and including chiropractic profession as part of that.
Yeah.
So he was a great leader and great integrator. But, it was your character, it was your perseverance, your academic and professional example that made them feel comfortable and said, this is somebody who we feel comfortable with, have confidence in, and would like to be a part of that. And that certainly that two of our mentors, Al Adams and Lou Sportelli, had the confidence in you, which you deserve. You earned it.
Well, you just said mentors too, and mentors are the key to our successes, right? Dr. Skogberg, Dr. Sportelli,
Richard Vincent.
Dr. Vincent, yeah, Richard Vincent.
Yes.
I mean, these were all mentors to all of us, and really helped to move our career pathway forward and this profession forward as well. So
I said for years that I was the product of many great men who mentored me, and I didn't really understand why they put up with me.
They put up with all of us, right?
I asked a million questions.
Yep.
I was a lot of times argumentative because, I didn't see it the way they did, and it didn't make sense, or I had a different perspective, and we would debate things. And from a baseball batting average standpoint, I think my batting average where, I was correct was somewhere between 0.05 and 0.10, maybe 1 in 100 or 1 in 200 times my points were correct, but they've still put up with me. And I felt very honored that they did.
What do they say? They say, pay attention to the guy asking all the questions, not the one with all the answers. Because the guy with all the questions is going to make you think.
Yeah.
It's
Einstein said, curiosity is more important than knowledge.
Yep, absolutely.
I'm sure it's true.
Yep. I remember sitting at a dinner at one of our research dinners, and we had Rob Vining there. Rob from who's one of the research directors over at Palmer, and I had our incoming fellow and the director of research at the Osher Center at Harvard, and we had a whole group of us talking, and Peter Wayne, who is the director of research at Harvard, was asking questions of everybody. And I remember Rob Vining leaning forward to Ren Burton, who was the incoming fellow, and saying, "Pay attention to the guy asking the questions." He said he has all the answers, but he's going to get all the answers. He's going to solicit answers from everybody else. And he was right on. They say the guy with the questions learns the most. So
absolutely. So then let's talk about your role there and what you're teaching and what courses you're teaching, to whom, and then also a typical week in your practice also at Harvard. What's it like nowadays?
So I have a really kind of a mixed life here. I work in an integrative care center. I'm the associate clinical director, which basically means that I'm the director of the clinical operations of the center. We are located about 3 miles outside of the main campus. We're in a five-story building here that is it's a microcosm of healthcare. We have everything from primary care to orthopedics, pain management, endocrinologists, this whole list of places, practices. And then we're embedded in the center of this. And our integrative care center has chiropractic. We have four of us. We'll bring on a fifth. Acupuncture, massage, integrative health coaching, integrative medicine consultations. We have a headache neurologist in our clinic, and several. We have several medical physicians in here as well. So I see patients 2.5 days a week. I have two and a half full clinical days. I have administrative time to do things like this, and also do things to help develop the clinic. And I also help put together educational programs for the public, or even for other departments as well. I don't go to a classroom and teach. That's not what I do. What I do is I am a clinical mentor to our fellows. We have one graduated and another incoming chiropractic research fellow who are fully supported by the NCMIC Foundation. They come for 3 years. In those 3 years, they spend 2 years and get their MPH at the T.H. Chan School of Public Health at Harvard. They work under the research mentorship of Peter Wayne, who is, again, the director of research for the Osher Center, and they have clinical mentoring here under my direction. So that's one of the things that I get to do. I work with medical residents as well, who may come and shadow for parts of the days. Most of them are in primary care or internal medicine, so they'll come and shadow as well. Most recently, I brought in even a college intern who is looking to become a chiropractor. So she spent 12 weeks with me, 3 mornings a week, 12 weeks, meeting patients, observing clinical care, going through diagnostic imaging, and we had just a really wonderful experience. But we don't yet have a residency program for chiropractors. The state laws aren't set up to really support that, and the hospital bylaws really right now are not set up to support having interns who can treat patients in our facility. In fact, we want our clinicians to have at least 5 years of practice before they see patients in our clinic. So on a daily basis, I'm doing my treatments. I also work with the research department at the Osher Center at Harvard. So we have currently 2 NIH studies, one that just finished up on chiropractic treatment for neck pain, and combined chiropractic and Tai Chi for patients with chronic neck pain. Our other study is chiropractic versus usual care for patients with episodic migraine. And in fact, that's a multi-site study. We're doing that in collaboration with the VA and Yale, and as well as Harvard. So we have Anthony Lisi and the VA Centers for Headache Excellence working together with us on the same project, on the same study. And that one's really just getting off the ground. That project came together because of another NCMIC funded pilot study that we did on treating episodic migraine with chiropractic treatment versus usual care, which had yielded some really great results. So that led to a grant proposal to NCCIH, another successful one. So I work on that research team as well. And as far as teaching goes, I will do educational programs for interdepartmental education, and I may host programs for internal medicine, for pain management, for sports and rehab. So I'm basically educating more on integrative care and chiropractic's position on integrative care and how we can actually collaborate better together. So kind of a bridge builder for our clinic as well. So the designation of an instructor in medicine really comes from, as you had pointed out, publications, being involved in publications, being involved in research, being involved in education, and that lays the foundation to satisfy the criteria to become an instructor. And then there's a ladder program within that as well.
I think it's fantastic. So I have a couple of questions, or I'd like to get your thoughts on one. You said that you have some interns, or you have a fifth chiropractor you said was coming in, right? That you guys would be considering here soon.
So we have fellows. So our first fellow completed the program. She completed the 3-year fellowship. Our second one is going into has just entered her second year, and then will be going, she'll begin the MPH program at Harvard. So she's been working with the research department at the Harvard Osher Center for the last year, and then applied to get into the MPH program. And all of that, again, all of this is 100% supported by the NCMIC Foundation. And it is working in a parallel track to a T32 fellowship. So there's a T32 fellowship that's running, an integrative medicine T32 fellowship that's running at Harvard. And it's been running for 20 years now, again, funded by NCCIH. And at the time, chiropractors really wouldn't be able, unfortunately, to compete to get into that program. And what we're hoping to do is to get a group of chiropractors coming up in the profession that can do so, that demonstrate an interest in research, an involvement in research early in their career, so they can then have the credentials to apply for something like this T32 fellowship. What's been wonderful with Ren Burton is that she showed that this can be done. She came in green to research, and was really thrown into a program with people who were medical doctors, who are already PhDs, who are going on a research track to get this MPH program. And she swam and swam and swam and really made her way through, and has done a phenomenal job with it. I think she's got 8 or 10 publications already. She has applied for and received the LRP, the Loan Repayment Program, through NIH. And she was just funded for a T90 fellowship as well. After the T90 fellowship, where she will probably go on for a K award as well, so for a career pathway in research. So incredible success story. And following up her is Macy Randolph. Macy is also a DC who is then going through that same track. And this has all been privately funded through the NCMIC Foundation. That's going to end, where we'll have an N of 2. And then hopefully have people who are qualified to compete for those programs through the federally funded T32 program. They just entered their first naturopath into the program. So this can be done. If we get prepared chiropractors for this, this can be done.
A side note that I'll just add in there, you mentioned it a couple of times, Nick, as I believe that you are still on the board. Is that
Yep. So full disclosure, I am on the board of directors of the company. Yeah. I'm on the advisory board to the foundation.
Yes.
And yes, so I've been on the board for about 20 years.
Yes.
And it's a corporation that has been developed by chiropractors for chiropractors and continues to support the chiropractic profession in incredible depths that I don't think the profession will actually ever realize.
That's right. That's right. And putting money back into the profession and into research. I'm well aware of it. So thank you for your time and energy into that. My final question, maybe kind of a question, is what advice do you have? We've got a couple minutes left. What advice do you have for young chiropractic students and for their focus, for their, what would you do if you were going into the profession right now, working your way through school, what advice would you give them? What characteristics, what side capacities, learning, or strengths should they work on in order to optimize their potential to be able to have a successful and optimal, a great professional life, and be able to not just survive, but to thrive into the future and be a critical component into their region or into the profession, going for a successful lifetime, like you are an example of?
I would say that your education just started. You graduated, you have a degree. That should not be the end of your education. It really should be the beginning. You should start to have developed interests that you can now focus on. But as you and I have both said, you need a mentor. We all need mentors, and we're built by the people who helped build us. And so latch on to someone who will help you through your clinical work, your business work, and your social work as well. This occupation is a very social occupation, and you had said it right at the beginning that the orthopedists trusted you. They didn't trust the chiropractic profession, and you built a trust with them, and you have to have some thick skin and a great knowledge base and learn the language of medicine. Don't expect medicine to come to you. We're not even thought in the process. We need to bring it to them, and we need to bring it to them in a humble way, with evidence, and with humility, with humility and evidence, and learn to communicate with people, learn to communicate with other professions. Don't go in with the idea that I want to meet other medical professions to send me patients. That's not the reason. The reason why we want to meet and work with other professions is to help our patients more. And it's if we put the patient in the center of our concern, in the center of our direction and our mission, I think we'll succeed. If we put ourselves in the center of our direction and mission, it's going to show. It's going to show very quickly to the people that you're trying to collaborate with. So attend medical conferences, go to grand rounds, go to medical grand rounds, learn the language, learn the process, and then start to be present in the medical profession as well. But don't forget about the chiropractic profession. Give back. The only reason I'm in this position is because other people gave back,
Right.
and helped me move forward, and they keep giving back. We have fellows here and at the VA and at other universities because people in this profession give back. And so, I think giving is key. And if you can't give of your resources, you can certainly give of your time and your own mentorship as well. We are a small family of a profession, and we need to get close to each other and work with each other, and not compete with each other. We can do a heck of a lot more as a family than we can as a maverick trying to blaze your own trails. So
Beautiful. As a friend and a mentor of mine and a contributor on the textbook also, the great physical therapist Robin McKenzie told me many years ago, he just said, just always remember, it's for the patient that we all exist.
Yep, absolutely. That is the key.
Matt, thank you so much. We're out of time, but this has been fantastic, and I can't thank you enough for taking the time to share this. And I'm sure you'll be an inspiration to a number of younger clinicians. You may be a physiotherapist out there. You may be becoming a chiropractor, maybe in practice. But what we see here is, in the end, character counts. And what you see with Dr. Matthew Kowalski is somebody who has straight through, has put his time in, has had the passion, has been the example of what we're looking for to be able to help more and more patients as we grow to become more united in our approach to management for humanity. Thanks, Matt.
Thank you for helping be part of the team that built all of this. It's absolutely a component of our advancement in the profession, as well as advancement in my whole career. So thank you.
All the best. Thank you again.
All right.
Bye-bye, everybody.
Thanks for tuning in to this episode of the ACES Optimist Show. Catch you on the next one.